Hi, everyone. Welcome back to another episode of Heart to Heart. As you guys know, this is our IGTV series, which is now on YouTube, where we interview today's cardiologists and physicians on their journeys in medicine and really just trying to get to know them as people. And today, I'm very excited to have another pediatric cardiologist on the show. So this is Dr. Jennifer Kovu. She received her medical degree from the University of the Philippines College of Medicine. She went on to do her pediatrics residency at the University of Illinois at Chicago Medical Center and her cardiology fellowship at Cleveland Clinic as well as Children's Hospital of Wisconsin. She went on to then complete a senior fellowship in non-invasive cardiac imaging at Boston Children's Hospital. She currently serves as the director of the Fetal Cardiac Program at the UF Health Congenital Heart Center and is also the director of the UF Health Congenital Heart Center Single Ventricle Home Monitoring Program. Say that 10 times fast. She's also a pediatric cardiologist, a part of their Turner Syndrome Center, and she's a strong #WIC, aka Women in Cardiology advocate and leader, and is a part of SCMR, ACC, and a lot of national societies with an incredible social media presence over on Twitter. So welcome, Jennifer, to our podcast and series.
Hello, how are you guys? Happy to be here. Thank you for inviting me.
Thank you so much for joining us. So, just to get started with all of our guests, we like to ask about what was the inspiration for going into medicine and to pursue a career in pediatric cardiology?
Yeah, so when I was like all of us, when I was young, I've always wanted to be a doctor. I was a NICU baby. Actually, when I was born, I had severe diarrhea for whatever reason, and I was in the neonatal ICU for a long time. And according to my mom, so I was there for at least 2 months, and they thought that I was going to die. And after a couple of months, I suddenly recovered slowly, and I was able to be brought home. And this is part of what my mom tells everyone whenever they introduce, "Oh, this is my girl who was in the neonatal ICU." So ever since then, I was really inspired that I wanted to give back almost. That I wanted to be that doctor who helped save me. And I actually recently found out that the son of the doctor that saved me married one of my cousins.
Oh,
So, yeah. And then my mom says, "Did you know that that person married your cousin?" I was like, "Oh, okay." So that inspired me to become a doctor. Now, to become a pediatric cardiologist, that came late. Believe it or not, I was supposed, if I stayed in the Philippines, I was supposed to be an ophthalmologist.
oh, wow.
I was starting ophthalmology residency, and suddenly I deferred. I had a very early midlife crisis, and I thought, hey, I haven't done everything that I wanted to do. I went straight to college, went straight to med school. Then now I'm doing residency. Before you know it, I'm old and I won't be able to do whatever I want to do. And a lot of my classmates were taking the USMLEs at that time and going to do residency here in the US. And I said, oh, let me just take my USMLEs in preparation for fellowship. For ophthalmology. So I said, can I defer for 1 year and then I'll come back and then I'll do my MLEs and then I'll come back so I can do my fellowship in the future. And I remember the chief resident told me specifically, "You're not coming back. I have a feeling you are not." And so here I am. I went to pediatrics residency at University of Illinois in Chicago,
Mhm.
and one of my first rotations was pediatric cardiology, and I just fell in love. It just made sense to me, everything clicked. And I never really loved cardiology as a med student. I don't know why. And but as a pediatric resident, everything suddenly clicked. Everything made sense. And I before I went to pre-med, I was an engineering major. So I love the math aspect of pediatric or cardiology in general. And I love puzzles too. And so as Amisha would attest, especially complex congenital heart disease is like a puzzle waiting to be solved. And I've always wanted to be the first one to solve the puzzle. So I loved, as a fellow, I loved being the first one to get the admission and it's an unknown. Oh, I want to figure out the diagnosis. And now that's why I'm the fetal cardiac director, because it's not most congenital heart disease are prenatally diagnosed. I still want to be the first one. So go to the womb and be the first one to diagnose complex congenital heart disease. And I love the challenge. That's why I think in the long run, I think I made the right decision in going to pediatric cardiology. It's something that there's not a day that's not exciting. That's not a day that is not that is mundane. And I love going to work, and I love being a pediatric cardiologist.
Oh, I mean, I love hearing that, obviously. But I think it's so nice to hear everybody's individual journeys, because I had a conversation with a group of students in college recently. And I said, you know what? It's okay to change your mind. It's okay to figure it out on the way. And, based off of your story, that's exactly what you did. You listened to yourself, pursued your interests, and you found your way into something that you obviously love doing, which shows through so beautifully, in your story of how you got to being a pediatric cardiologist. So I think that's just so valuable to hear from a younger generation, for those of us coming behind us. So thank you for sharing your story.
Yeah, it's never a straight line.
Yeah.
My advice is never a straight line. Do not take opportunities. Do not be afraid to change your mind so many times, because in the end, when something does not click, it might not be the one for you. Like, it might not be, whether it be a career or a relationship. In the end, if you change it's not forbidden to change your mind, and there's a reason why you're changing your mind.
Yeah, absolutely. And I think, one of the reasons why, and we talk about this all the time, and Misha and I talk about this all the time, but one of the reasons why we started this whole, heart to heart series was really to show people that nobody really has a straight line, right? Like if everybody just read your resume right now, like Amisha gave you your introduction, you're incredibly accomplished, you have all of these great leadership positions and all of these things, people would think, wow, I mean, she's perfect. She was able to just do all of this stuff and look at where she is now. Little do they know that you didn't even have an interest in pediatrics, let alone pediatric cardiology, years ago when you were in medical school. And, you had no idea that this was going to lead you to the US, and you were going to choose this field and be where you are. So I think it's really important to show that message, like you two just pointed out, that, everybody has a different path, and it's okay if a few doors close, because you never know what the other doors are going to open for you.
Right. That's right.
Yeah. So, speaking of leadership positions, you clearly are very involved in, ACC WIC, SCMR, like we were able to do the conference together not too long ago. And you also hold so many of these great leadership positions, even within your own institution. So how are you able to rise up in the ranks? And what kind of advice would you give to students, trainees, and even early career physicians like ourselves, who have similar aspirations for their own career?
I think one, always take opportunities and seek opportunities. And if you're given an opportunity, take them. So when I was a young faculty, when I was starting, I was like most young faculty, probably said yes to everything. I said yes to everything, and they said, "Oh, can you do this? Yes. Can you do this? Yes." And I know that I've taken a lot of things at one point, but like most most cardiologists, we're all type A, and we want to do a good job at everything. And that eventually led me to where I am. I think much as we want not to do a good job, I think we're all conscientious and trying to um, uh, uh, make everything excellent. So that's one of the things that led me to wherever I am now. So I love, I'm a non-invasive imager. I'm trained in fetal cardiology. I'm trained in echocardiogram, TE, transthoracic, cardiac MRI, and CT. Now, when I first started at University of Florida, that was, and they were able to let me do whatever, like all the things that I'm trained at. Like in some institutions, you would either choose fetal or MRI. I'm just lucky that there was room for me to do both, and I wanted to do both, and or I wanted to do all. So I think one of the advice that I would tell a young faculty is be good at what you do. Like strive hard to achieve clinical excellence. Never say, whenever I know that there are times when questions can be like, if there's a lot and somebody is going to, hey, can you take a look at this? Hey, can you or even just when you are an inpatient, there's a consult, and sometimes it can be annoying. Oh, a tachycardia consult, and the patient has fever, right? But in the end, we all had those, right? And it can be annoying, especially if you're so busy. But always remember that all these services that are asking for your help are asking for your help. They need help. Yeah. And so if you offer your help, eventually if you offer your help and you'll be able to help, they eventually will ask you more challenging questions, and the real consults that you will probably of course be able to answer, because that's your subspecialty. And even with colleagues, give them the time to, they're asking, especially if they're asking you for help about a case. And I think the more that you do, and the more you are right in, or you offer them help, the more people will come to you and will seek for your help. And that's how expertise happen too. The more things that you see, because they will ask you, hey, can you take a look at this? What do you think this looks like? And it can be something that is challenging, and you figure it out together. And so it's not just being able to offer your clinical expertise, but also learning from them. And that makes you better. And I think all in all, achieving all this clinical excellence and being able to help other people will catapult you to, hey, whenever there's an opening, or whenever, hey, there's a leadership position. Hey, Jen was able to do this. Jen was able to help me every time that I ask her to. Maybe she can do this. And so that's how for example, the single ventricle program, when I started, nobody has been doing it, but it's how I manage my patients. And in the end, I was, if I have to be honest, I was reluctant, because I don't want to take more responsibility. And so I said, anyone can do it, I'll just help. And in the end, since I'm managing all these single ventricle patients the same way I was taught how to, and same way as the National Pediatric Cardiology Quality Improvement Collaborative, or NPCQIC, say that 10 times. That's the way I was taught how to do things. And so I said, give it a name. Fine, give it a name. Give it a name, and I'll start it. I'll start the program. And for now, this is one of the things that I'm proud of, and my team is proud of. Since we started the program, we've have a mortality where national mortality is 5 to 20% interstage, so in between stages. So for the single ventricles, there's 5 to 20% mortality. Since we started this program in 2012, we have interstage mortality of 0%.
Amazing.
It's incredible. It's incredible. And I think, the biggest points from that is that like hard work will get you where you want to go, right? Whether that's with patient care, whether that's with leadership positions, whether that's with personal passion projects, right? I think that, your story and your rise to these leadership programs and your success with your programs basically boils down to that hard work aspect, and then people see that. That's what they see in your university or your program. And I think that's important for trainees to understand, because all of us, when we were trainees, we're just trying to get it done, right? We're trying to do the right thing, do it the best we can, and get it done, because it's a volume issue, it's a time issue, and so we're not really thinking outside of that box. But I think to remind ourselves when you're at that level, right? When you're a student, when you're a resident, when you're a fellow, that, you know what? Okay, yes, I need to do all of these things in this amount of time, and I need to do it correctly. But I also need to remind myself that this is learning. This is going to make me the physician who I want to be. And this is the time where I can build relationships as well. So I think, and I think that sometimes as trainees, it's just hard to remind ourselves of that. And so for me, when I talk to my fellows, going back to your example with consults, I try to remind them, like, look, I know it's a busy day, but to you, it should always be the heart unless proven otherwise, right? Because that's why they're consulting you. It doesn't have to be the heart. That's not, it can completely be the fever. It can be something else, right? But the reason they're consulting you is to rule out the heart. So in your mind, you have to think about everything that this could be for a heart etiology and then rule it out, right? And then that's going to make you the better cardiologist. And instead of dismissing things, accepting them and acknowledging them and growing from them. And so, I think all of your points are great learning and teachable points to trainees and to students, just to give yourself a moment to remind yourself that, there is a bigger picture here in this workload craziness that is medical training. And that, it is to become the physician that you want to become and do the things that you want to do.
And to dovetail to your point about building relationships, those are very important. I now have always a speed dial for everything, because at the same time, when they ask me, hey, can you see this consult? I know it's last minute. Can I add on to your clinic? I always say, of course, absolutely. If this will help the patient. Remember, there is always a patient. It could be work, but we are lucky to be in our jobs entail service, right? It's not hard to stay longer because you're helping someone. And so my point is, because I've said yes to a lot of people, in the end, when I needed help, hey, I have a patient that needed to be seen. They had another appointment. They came from 2 hours away. Is it possible you add him to your ENT clinic? And there you go. Of course, they said, because again, quid pro quo, developing relationships are key. And then in the end, you'll never know who will rise, like who among your the relationships you build will rise as well, and then will think of you and say, hey, she's helped me so many times, she's so efficient, she's so knowledgeable, I think she will be the right person for this leadership role.
Absolutely. So speaking of relationships, we were talking about this before we started recording, about connecting on social media and our journeys with different platforms. And so you told us a little bit about how you got started on Twitter, but what is your mission with Twitter? And you were a recent social media ambassador for SCMR as well. And how did you grow your presence there? And what advice would you give to others who want to do the same?
Right. So I've told you my story about how I will credit Dr. Pushpa Shivaram for starting for starting my Twitter account. She literally did. And I was hesitant at first because I've had, like, who has time for social media? But I loved it, and I love Twitter so much because I've made so many friends. My I think the objective for me, my aim for Twitter is to educate and for advocacy. You know, I think one of my second acts, I know it's so early to have a second act, is I've had this passion for women in medicine, you know, gender equity, diversity and inclusion. And because I have a daughter who is strong-willed and might want to be a doctor someday, and I want her to not experience the same things as us right now, you know, uh, not like gender pay inequities and whatnot. And I know that we won't be able to do much for this next generation, but hopefully the next generation after this, they will be like, right now she says, oh mom, why is there, why is there, she plays chess, and so she said, why is there all girls chess competition and not all boys?
Mm.
And I'm like, it's sexist. Poor boys, they won't be able to do that. And I'm like, oh, okay. I guess we did something right to be
Yeah.
able for you to think that this is the norm. And she's like, why do we have a lot of t-shirts that says girls rule, girl power, and there's no boys power, boys rule? And I said, because long time ago there were no girls playing chess, there were no girls that are ruling. Even the girls cannot even vote for a long time. And so I think this is Twitter is a way for me to start doing that, start working little by little, achieving gender equity, trying to educate, you know, try to look for allies, like he for she's. And that's one of the things that I've realized, you know, we might be doing things in an echo chamber. You know, women in cardiology, we're just talking amongst ourselves, but it's an echo chamber. We need to go beyond women in cardiology. We need to tell people in leadership, which most oftentimes are male, and I think we need them to be our allies as well. So I think Twitter is a good space for that. And I think, like, we have the women in cardiology, ACPC, or the adult congenital and pediatric cardiology group, has now taken over WIC-book. We are sponsoring WIC-book this month, and so it's like a Twitter book club. And we're doing a feminist fight club. So with feminist fight club right now, like, we're talking about little things like upspeak. Why do we do this? That's the topic for today. You know, upspeak is when you, in a statement, you add a little question at the end, like, you know, so let's say I say, like, and most women do this, you express an opinion. I think that is a wonderful idea. I think this idea would blah blah blah. What do you think? You end it with, what do you all think? What do you guys think? Right? And I think I'm guilty of that. I don't know if it's to soften the tone, because so it won't be too harsh or too arrogant in my mind. But again, it's only women who do that. So these things, so this topic, when we introduce it on Twitter, I bet you some other, like, I just realized that I do that right now. I bet some other men will just realize how many women are just saying in that thread, yeah, I do that. And then they realize, oh yeah, most of my women colleagues do that. And they don't really mean it, when in his head, they think that the woman is not confident, you know, because of that upspeak. But hopefully, I don't know if it will work, but that's one of my goals: education, advocacy. I during Congenital Heart Disease Month, I posted a lot of congenital heart disease awareness, and hopefully we could get more funding for research. And of course, it's not always business in Twitter. There's a lot of fun. I'm part of the Dogs of Twitter. I'm one of a few that got a pandemic puppy.
Oh.
We named him Hercules Mulligan from the British Tailor, who is the best friend of Hamilton in Hamilton musical.
Oh,
And
nice.
so he's a Pomeranian, and we love to dress him up. Poor dog. And that's how we sometimes connect with other people, and it's a nice break for all the seriousness and all the educational thread that we've been putting out there. And lastly, education, of course. I was part of the SCMR social media ambassador, and it was great. I developed a new skill of listening, thinking of what to post next, screenshotting, and then before the next session, I've already posted 3. It's like, what am I going to say?
Yeah.
And I think that I told one of my friends, Arwas AD, I'm like, oh, I have a new skill now. I think it's a talent. Four screenshots in one. Which 4 screenshots will I say? And I summarize this whole session in one tweet.
Yeah, that definitely was a talent. We did that together, and that was my first time ever being a social media ambassador, and I learned real quick to be on my feet. But I feel like it was such an incredible experience, because not only did I learn so much, but I learned how to I was new to Twitter. I mean, Amisha and I are pretty new to Twitter. So to go from that to being a social media ambassador on Twitter, I was like, oh my God, I have a lot to catch up on. But I feel like towards the end, I got the hang of it. It was fun.
Right.
But yeah, you brought up a lot of, really good points about the utility of social media in general, right? I mean, I think a lot of us back in the day when we were, going through our med school and our training, social media wasn't really a part of that, right? I mean, I think this was towards the latter end.
Absent.
Yeah. And I mean, even for
old.
us, we had oh my God, we had MySpace and then Facebook, Friendster, all of those things. All of those things. But I mean, that was purely for just the social, personal aspect. We didn't involve our careers, our schooling, our training into that. And this whole educational aspect, this advocacy aspect of social media has become a huge, aspect of all of our lives, right? I mean, I feel like that's what we're doing all day, every day. So it's incredible that you can educate, you can, be an advocate, you can, advocate for women, advocate for diversity. You can, do these, leadership positions, engage with more people around the world that you would have never even met. People have written research papers with people that they have never met before. I mean, there's so many different tools, and then of course there's the negative aspects of social media as well. So you have to understand where that balance is. But the fact that you can do all of those things is absolutely incredible. And you're a true testament of that, right? I mean, you just listed all the things that you were able to do just on one platform. We will say we do have to get you onto Instagram though, our platform.
We can use our ACC article to help you.
Yes. So I have Instagram, but it's covert, where you post photos of your vacation.
Yeah. You could do that separately, and then you could have a public account as well. Join the club.
Yeah, definitely.
We need more cardiologists. I feel like on Instagram, we don't have that many. We're
definitely pediatric cardiologists too. Yeah,
right,
yeah,
right.
definitely.
And I think it's like I still have Facebook, and in Facebook is where all the patients are. That's where I do my advocacy for patient care. I just remind them that everything is going to be, mostly positive, and recently with the COVID vaccine, I posted my take on, we need to do this vaccine. What are the myths? What are, because there's a lot of, there's still a lot of vaccine hesitancy.
Mhm.
And I heard that in my home country, the Philippines, there's a huge like vaccine hesitancy just because
Oh,
they don't have Pfizer and Moderna there. They have Sinovac. They
Yeah.
have
mm,
the Sputnik, I think the Russian one. And so I totally understand why, because they flip flop on the data all the time, and so they're really hesitant. But right now, I think a lot of my colleagues who went back there and they're posting their selfies as well, and a lot of my classmates were saying, "Oh, because if you don't post a selfie, it won't work." And I said, "Guys, it's advocacy. You need to." There's a huge anti-vaxxer social media presence
Mhm.
mm,
that we need to overcome,
mhm.
and the more people, how many have I convinced who will not get a vaccine otherwise, if they see that you get it and you're alive.
Yeah. No, absolutely. I mean, that's another form of the education and advocacy part of social media is that as physicians, we do need to combat this misinformation and help guide people. We're not going to give medical advice, but we can at least help in the understanding and the educational perspectives of the data, right? Of the evidence-based data. And we should have a voice there, and there's been some amazing trailblazers and leaders in social media for the physicians who started to do that and made it more comfortable for the rest of us to carry on that torch. And so I do think it's such an important thing in this day and age, and especially at this time internationally, for
Right.
sure.
Absolutely. So our last question for you, and you touched on this a little bit, especially, mentioning your daughter and about gender equity, but diversity and inclusion, as you know, within medicine has been a huge topic of discussion for a long time, but obviously within, recent times, especially with the pandemic, I feel like a lot of that, topic has become very talked about.
Mhm.
And not only in medicine, but within cardiology, whether it's adult cardiology, pediatric cardiology. So, what kind of changes do you think we need to make moving forward in order to further diversify the field with not only people of color, but women as well?
I think we need to start from young. We need to start in inspiring young ones. I think we need to especially women who are afraid to go to cardiology. How many times have I been told, "Oh, are you sure?" Even in pediatric cardiology, "Are you sure?" I initially wanted to go cath, and the first thing I was like, "Oh, do you want to have a family?" Is what my male mentors would tell me. "Oh, are you sure you want to go to cardiology? It's going to be a lot of work and a lot of time, and if you have family, you won't have work-life balance." But work-life balance is what you make it, right? And I can tell you my work-life balance is not perfect, and but I hired a nanny, and who I call my wife, and who takes care of the things that I usually don't want to take care of, like laundry. I hate laundry. And so I can spend more time with my family, right? The more important things. And so I think we need, going back to your question, I think we need to start um, to stop the leaky pipeline. There are um, a lot of young ones out there, young immigrants, young children of immigrants, young women who are discouraged by random person. Or and when they hear that, how many times have I heard that, "Oh, you can't do this because you are a stereotype."
Mhm.
Insert stereotype. And so and I'm happy that I'm strong-willed and I'm confident enough to to ignore the naysayers. But I think a lot of young ones are not, they need some encouragement. And I think that's what we need to do. And I think this platform that you guys are doing, and I support very much and I admire, should inspire, hopefully, with all the doctors that you've been interviewing, hopefully could inspire even just one teenager who wanted to be a cardiologist and who was told, no, you won't have a good work-life balance. Oh, you want to have kids? Oh, you can't do that. Med school is so difficult. Med school is so expensive. I think we need to start going from, even like, if you're invited, like me, many times I've been invited to make time to read a book for my kids' classroom.
Mhm.
And so I will make time, because I would read a book that is about science. I would always choose something that is like empowering, to promote the field, or to inspire kids to be not just focus on video games, or do more than what they aspire to, or affirm what they're thinking. Hey, I want to be an astronaut. Yes, you can be an astronaut. You can be whatever you want to be. And I think that's how to start from the grassroots, or from to stop the leaky pipeline.
Yeah.
But now here also, we need to be more inclusive. I think we have, I was telling leaders before, remember, we don't want manuals. Whenever we have talks, think about, are you sure you want that? Like, is there no other women that would qualify, because you already have 4 men? And you want the 5th panel, is there really no woman that is an expert in the field? I think we need to be more purposeful in looking at this. Same thing, fellowship. We need to equalize, make sure that it's equal. Not that we're not choosing the best candidate, but you have to be cognizant that you have if you haven't taken the implicit bias test. I've taken it. I'm surprised about a lot of biases that are inherent. And so I think those are the things that I like from myself. I'm part of a med school interview committee. I'm part of the fellowship interview committee, and a part of the residency interview committee. And I always make sure that whenever I choose, I'm not inherent to like biases that, hey, why is this? And I won't be, it'll be nice to be blinded, right? But unfortunately, we're not. And so I think we need to be cognizant of our own biases, promote, even if you say, like in med school interviews, I whenever there's a minority candidate, I'd always encourage that candidate, like, you're doing a great job. I highlight the things that they've done. And I think even if they don't get accepted, let's say from vote in the long run, I think our words matter. And I think encouraging someone, not just, and then trying to make sure that our choices are balanced, I think will hopefully change the future and will be more diverse and inclusive.
Definitely. I mean, because I think, there's like a famous quote, right? That people will remember how you make them feel, right? And I think the children, students, trainees, even, all of us, like everybody is very impressionable, right? And you develop the skills to combat, the naysayers, like you said, or the negative people that are around you. But you have to develop those tools, and you have to develop that with a support system of people who are positive impressions for you and who provide those opportunities. So I definitely agree with you. And I also with your point about biases, because, I think recognizing that we all have biases that, impact how we think, how we make decisions is important. for us to move forward and make it a more equitable environment, situation, job place, workplace, whatever we need to make better. So I completely agree with those 2 points. And hopefully, by recognizing these types of things and talking about it, there can be bigger institutional type changes from smaller actions.
And I think you represent, right? Right. Like there are inherent things in our culture that are that we know, like we know because we're part of that. And I think if no one's sitting on the table, they won't know. And so I think there are things that I think are people might think that are, oh, we already do a lot of things, we're already busy, the and you get invited to talk to, let's say, for me, the APAMSA, the Asian Pacific American, oh no, I'm gonna kill the
Association, yes.
of medical students, and
Yes.
they've invited me one time, and I made time because I know that hopefully, if I can just inspire one person, one student to pursue cardiology or to pursue medicine or to have the conviction to go forward, I hope that I've given that someone from that they think that represents, and they think that could be someone that they can emulate. If I can only do, like, if I can only convince one or inspired one, I've done my job, and I think, and it's same thing, like representation matters, right? If my daughter doesn't see any Asian woman actress, she won't want to be an actress because she thinks that she can't be. She needs to be blonde and fair to become an actress. But the fact that she sees, a lot of Netflix shows right now who are like Over the Moon, is about Asian culture, and she saw that Philippa Sue, who is Juilliard trained and who is a Tony Award winning in Hamilton. I can be her because I look like her,
Right.
and so I think that matters.
Yeah, absolutely. It definitely does matter. And again, I think it's, platforms like social media, like, what we're doing today, putting out our voices and, showing ourselves what we look like, that we don't look like the typical, white male cardiologist, that, we're all cardiologists in different specialties in different fields, and we're doing it too. And that if you want to do EP, you can do EP. If you want to do interventional, you can do interventional. If you want to be a surgeon, you can be a surgeon. It doesn't matter. And I think it's really interesting how you said it really starts at the grassroots, right? It starts at the beginning, because there's been many a times where all of us have experienced, some person or another that told us that, I don't know if that's going to be a good field for you. I don't know if you're going to be able to do that, because your expectation as a woman in society is to have a family, have children. So how are you going to do that? Plus, do this. And if we're having our mentors, people that we look up to, guiding us in that way, I mean, that's just, that's something that we definitely need to change. So I think it takes a lot of us, but I think slowly we're starting to chip away, at that. And I hope that, like you're saying, maybe not within this generation, but the future generations, we definitely can see a lot more of a change. So, we had such an amazing conversation with you today. We seriously could talk all night. But do you have any lasting words for our audience before we go?
Right. So, for everyone who wants to be a doctor, a cardiologist, or go to the field of medicine, don't be afraid. You know, drown the naysayers. Don't be discouraged, and drown the naysayers. Even the naysayer is yourself, especially if you're the naysayers yourself. You can do things that you think you can't do, and you need to be resilient. You need to take opportunities, and be positive and be passionate and try to find a way to make a difference.
Absolutely. Those were such
Well
great
said.
words. Phenomenal. Phenomenal. So again, thank you so much, Jennifer, for joining us today. And if you want to see more of Jennifer's education and advocacy, you can definitely follow her on Twitter. And then we're going to try to convince her to be more active on Instagram, maybe even start a TikTok or two, one step at a time. But again, thank you so much for joining us. And thank you to our audience for joining us. And we'll definitely catch you in the next interview. Bye, guys.
Thank you so much.